Move on to our next speaker this evening, Ciara Reid. Ciara graduated from UCD in 1996, and I think Ciara and myself will both agree that was a vintage crop, if we do say so ourselves. She spent 6 years in mixed practice in the UK and returned to Dublin to companion animal practice, and then she made a leap to industry, working with a pharmaceutical company and pet nutrition company for 13 years before taking up the position of practice manager at Ark Vetcare with a team of 22 vets. She's a past president of Veterinary Ireland, and as we heard earlier on, she was appointed as the chairperson of FAWAC earlier this year. Ciara and myself haven't really come across each other much since we graduated, apart from following football, and I think it's fair to say, Ciara, you've had the upper hand.
Ever so slightly, but yeah, not this year.
Yeah, well, I think we have to take gifts when we get them. I suppose why we're talking about companion animals here is we normally associate zoonotic disease with livestock and wildlife, but we rarely think of them in the context of the best friends and pets that we share our homes with. But I think they're really positioned in a place that if they have a zoonotic disease, that the level of contact is such that a zoonosis could be transmitted. So I was delighted when Ciara agreed to give this presentation on zoonosis in pets, because I think it's something that we probably don't think enough about. So I'll hand over to you, Ciara.
Great, thanks, Damien. Can everybody see my screen okay?
Yeah, we can see it.
Great, super, okay. So thank you, Damien, for inviting me. It was fortuitous, I suppose, the week that I was speaking to Damien, that I had a case in practice, and I've been covering quite a bit of clinical work. I think everybody's aware that there's a veterinary shortage, so I've been getting my hands dirty quite a bit this year. The way I'm going to talk to you all this evening is very much the way I encourage my team of vets, and I've got a team of 22 vets, to talk to our clients and come through about the potential diseases that we see in practice. So the first one that we really talk about is toxocariasis, roundworms, and roundworms are very, very common. Common in both cats and dogs, primarily in our puppies. Most puppies that we'll see will come in with round bellies. They've got a very big, very heavy worm burden. Toxocariasis in humans has always been something that's touched a nerve with me. My father had detached retina a significant number of years ago, and he was in the Ioneer Hospital, and there was a child about 14, if I remember correctly, in the bed opposite him, and he had ocular larval migrants and lost his sight due to it. So it's always something that I've been very conscious of, and it's always something I've been very conscious of, especially when clients come in with young children. Certainly last year, as most practices in Ireland and across the world really were practicing curbside medicine, we weren't seeing our clients coming through the door. We were having conversations with them as they were sitting in the car. We weren't having our puppy parties. So we really missed that interaction to find out how many young children in the family. And I always love it when there's kids in the room with us. Certainly from my own children, I know if somebody else tells them to do something, there's a better chance that they'll listen. And it's just so important for children when there's new puppies that they practice good hygiene. So I'm really glad that I am practicing the same as what Margaret said, that public education is so important. The main way that our clients can pick up toxocariasis is from contact with the feces, so cleaning up after the dog, and certainly with puppies, there's going to be poo in the kitchen when they come down in the mornings, digging in the garden. I am that parent who will not let my children into sandpits at playgrounds, and there's been many times that I've been that parent dragging the children away because they're screaming and shouting at me because they won't go into the sandpits. I see sandpits as giant litter trays, and they make my skin crawl quite literally. But the main way that our clients can pick up toxocariasis is from the dogs and the cats literally just sitting on their laps. That we all know dogs and cats love to lick themselves. They all love to lick around their perianal areas. And then especially with cats, they'll lick elsewhere on their bodies. And eggs can be deposited all over the hairs. And then if people are rubbing their pets, petting their pets, that's when it can be transmitted onto their hands, and that's when it can be ingested. And the eggs will then travel and can cause ocular larval migrans, as well as some cerebral issues as well. Now, when it comes to toxocariasis, Margaret is obviously going to be the person who'll have the numbers for you. I certainly couldn't find any numbers for Ireland, but looking at the US and the UK, it is very, very rare, thankfully. But if it is your child that contracts ocular larval migrans, it's obviously catastrophic if your child goes blind. So the sort of information we more these puppies and kittens on a very regular basis, and that's all very much going to depend on whether they've been wormed by the breeder. Certainly over the past 18 months, the sort of puppies that are being produced in Ireland, as we're all well aware, are not coming from particularly good backgrounds, are not coming from well socialized or even well hygienically brought up puppies, that there have been an awful lot of puppy farmed puppies. So the chances of them having had a vaccine, the chances of them being microchipped, let alone the chances of them being appropriately wormed before they moved to their new home, have been very slim. So when we have had a puppy in that has had a dubious start, we will recommend that they're wormed every 2 weeks until they're 6 months of age. And then very much it depends on a risk assessment thereafter. So if there are young children in the house, if there are immunocompromised people in the house, we will recommend that the puppies are, and that once they become adult dogs, are wormed on a 3-monthly basis. If the risk is low, we'll say every 6 months. But we cannot stress enough the importance of good hygiene. And as I said, especially when there's new puppies, new kittens, they usually come with young children in the household as well. I would have always asked my children to say happy birthday twice when they were washing their hands. My youngest daughter started junior infants this year, and I thought Baby Shark had left our lives, but Baby Shark has now moved into wash your hands, do. So that's what we sing now, just to try and encourage the children to wash their hands as well as possible for as long as possible. Another disease that we worry about for our clients is toxoplasmosis, and I'm delighted to hear from Margaret that the instance is extremely rare. As Margaret already said, the main reason why it is of great concern in humans is especially for pregnant women, that it can have catastrophic effects on the fetus. The main way, again, that pregnant women are going to contract toxoplasmosis is through cat feces. So the litter tray and digging in the garden. As Margaret said, if a fetus contracts toxoplasmosis, it really is catastrophic, but thankfully it's not that common. So if any of our clients who are pregnant and have cats, we will recommend that they don't change the litter trays, that's a job that's given to their significant other, that they don't dig in the garden, as we know many cats will use the garden as their toilet rather than litter trays. And if they are digging in the garden, really important to use gloves and to practice good hygiene. As I said, a lot of the puppies that we saw last year came from dubious backgrounds, and one of the most significant diseases that we saw last year in our puppies was Giardia. And really you can see this is just the number of tests that we would have performed prior to last year, and still this year we are seeing more puppies presenting with Giardia, presenting with diarrhea, really foul smelling diarrhea. Now, a lot of the time we are serial testing these patients because it's not easy to eliminate. Quite often they will need 2 or 3 courses of treatment to get rid of it, and we will continue to test them until we have a negative sample. And again, you know, it's a new conversation that we've had to have with our clients this year, that you know, puppies with diarrhea, there's diarrhea everywhere, and they'll usually have diarrhea in the car when they've been collected. There'll be diarrhea in the kitchen when they get up in the morning, and this is a zoonosis, and it can lead to diarrhea in humans. So again, the message is all about good hygiene. Salmonella and E. coli are diseases that we're starting to worry about more and more in companion animal practice. And I actually had a case of salmonellosis 2 months ago in a new age bulldog. And as one of my other team asked, what was that? It was a puppy from a very dubious background from Tala. So main way, and it was very easily figured out how this puppy got it. The puppy was being fed a raw diet, and raw feeding has become quite trendy over the past while, and it's quite a controversial topic. We obviously have to be very careful with what we say to our clients. If people want to choose to feed this to their pets, we will not necessarily support them, we will discourage them. And the main reason we discourage them is because of salmonella and E. coli. So we know if meat is not cooked, that these bugs can potentially continue to replicate in the bowel. We know dogs and cats will lick their perianal areas, and then they could potentially lick the owners, or they'll lick their coat, and the bacteria will be contracted and passed on to owners that way. When it comes to raw feeding, there are some commercially prepared products. Some will be frozen, a lot will be freeze dried, and certainly with those there will be less risk, rather than going and the owners getting some raw meat and just feeding it to their pet. So, you know, we have to look at this holistically as well. I think any of the lectures I've been to over the years when I worked in pet nutrition, even the most avid advocates of raw feeding would say that raw foods are not suitable for puppies and kittens because they are not a balanced diet and they're not formulated for growth. So certainly with puppies and kittens that we see that have been fed a raw diet, we are seeing again congenital and developmental abnormalities, primarily orthopedic disease. But we obviously have the risk of salmonella. And the case I had recently, it was a Monday morning when I saw the results, and I have to admit my heart sank. There were 3 generations living in the house. There was Granny, who wasn't particularly young, and there was a new 4-month-old baby who was down on the floor playing with the puppy. Now, from what I can gather, 2 months later, nobody in the house has contracted salmonella, but it was a huge worry for the whole family. For us as a team, we now have to be very conscious of patients coming into the hospital that are being fed a raw food diet. So we will instigate a barrier nursing plan for these patients. We will ask that the owners bring in their own feed bowls. If they don't bring in their own feed bowls, we'll bin them afterwards, because we know it is very difficult to get rid of salmonella. We need to work harder on this. We've only just started to put a practice protocol together, and really I need to support my team and my colleagues to make sure that they don't pick up this, because we are seeing more and more people feeding raw feed to their pets, and it's becoming the norm with certain breeds of dogs, especially some of the bull breeds then as well. So I think most people who have a dog or a cat have seen their pet like this cat in the picture at some stage. pets lick their perianal area, and if there are bacteria sitting around their anus, if there are eggs from Toxicara, they'll then lick the rest of their coats. There's a very good chance that they'll lick their humans, especially puppies. They're going to be licking kids' faces. They're going to be sitting on the owner's laps. They're going to be transmitting the eggs, the bacteria onto the owner's clothes, onto their hands, which can then spread and cause disease in this way in our clients. So I'm delighted that I still have the same message as Margaret. I don't think I can say enough, when you have dogs and cats, to wash your hands as frequently as you can. Certainly wash your hands before you eat, and encourage your children to do that as well. I'm going to recommend that you consult your local vet and make sure that you do a risk assessment for your dog and your cat to make sure that they are wormed on a regular basis. Be careful cleaning up feces, use gloves if you can, wash your hands afterwards, and ideally, to decrease the risk of salmonella and E. coli, feed a good commercially prepared diet. Okay, so I'm fully aware that I'm sat between you and equity, or I'm celebrity, so I leave it at that. Thank you, Damien.
Thanks very much. Thanks very much, Ciara. And as a household that's going to be bringing a puppy here in the next few days, that was very informative for me.